here's one of the things that it does. It appears to have an impact both on calcium deposition and removal from bones, as well as diabetes. So this is going to be a short video basically describing and giving you a heads up regarding a series or mini-series that I plan to do getting started on. It's on vitamin K2. Sometimes you end up doing the right thing for maybe not the best reasons, but that happens, and I'll get to that in just a minute. So here's my history on K2. I'd really never heard of it until a couple of years ago. Like many things, I heard it from a viewer. He mentioned it. I thought I had done something on K2 because I did know it was, I had heard of it. I did know it was related to calcium, but that was about it. So I started doing some research. I focused mainly on the randomized clinical trials. That is the standard. I mean, that's the best type of research you can do. It's the most convincing. Again, it's the best evidence. But you don't always have randomized clinical trials. Now, it looked like there were some, and I will tell you, there are some. The randomized clinical trials on vitamin K2 really don't show that much yet. Will they show? There's more going on because the interest continues to focus on K2. And it's like many things, it's based on some logic and hopes and other things. So here's where the part about sometimes doing the right thing, but not for the right reasons. So I've got this channel. The focus is to get people to recognize they've got insulin resistance or other reasons to have heart attack and stroke. Because most people that have these problems don't know it. They just start growing plaque for 20 years, and then all of a sudden they have a heart attack or a stroke, and they're surprised. There's also a major conception that you can't prevent or slow down plaque growth, and you can prevent it, you can slow it down, and you can even reverse it. I've got several videos on that as well. But here's the rest of the story. So someone else did a video on K2. My original K2 video was my number 2 video and driving a lot of views. When that new one was published by somebody else, mine tanked. My ego got involved, and I started looking that up and saying, what's going on? So anyway, it motivated me to read this book, Vitamin K2 and the Calcium Paradox. Now, it was written by a doctor of nutrition, Kate Rome-Bleu. I think I pronounced that right. Here's the thing. What little I had seen and read about the topic and listened to some of her videos, I felt like she was way overstating or at least implying some things in the science that weren't ready to be implied. After reading the book, I'll still agree, and I still feel like she gets out over her skis. But you know what? People that overstate something sometimes, or even some people that totally misrepresent, sometimes are right. So I'm not saying she's misrepresented. I'm saying she does, again, get a little bit too aggressive in terms of, everything's due to the fact that we're no longer eating cows or other animals that eat grass, they're eating corn. I realize that's a bad thing, and that's a big emotional appeal. But again, I focus on the science and the scientific evidence. Here's where the book really hooked me, though. It has to do with a thing called osteocalcin. And I was totally unaware of that entire metabolic process until I started reading this book and investigating. Here's vitamin K2, phyloquinone, K2, MK4, MK7. In the series, I plan to get a little bit deeper into those things. Now, what is osteocalcin? I don't fully understand it yet. I have to do more investigation on it. But here's one of the things that it does. It appears to have an impact both on calcium deposition and removal from bones, as well as diabetes. So I'll just hit a couple of quick, I wanted to keep this video below 5 minutes, and I've already gone beyond that. So I'm gonna cut it off now and just let you know, there's some interesting stuff here. Looking forward to the next videos. Thank you much. Would you like to get your CIMT and labs all coordinated for you and done at one time over a 2-day period? Check out our event. It's going to be in Louisville, November 8th and 9th. Here's the thing. I felt like if I heard one more time or read one more sentence about Weston Price or we need to be eating animals that have been raised on grass instead of corn, that my eyes were going to cross. So what's all this buzz about K2? Sometimes it feels like there's a lot more heat than light around this subject. I recently read that book, Vitamin K2 and the Calcium Paradox, by the lady from Canada who's got a doctorate in nutrition. And here's the thing. I felt like if I heard one more time or read one more sentence about Weston Price or we need to be eating animals that have been raised on grass instead of corn, that my eyes were going to cross. Let's not throw the baby out with the bathwater. When you start actually digging into the science behind some of these issues, there's some very interesting science there. And we're going to cover just the beginning of an early side story around the science in this video. It's going to start with a discussion about an article from a standard American medicine cardiology journal, the Journal of the American College of Cardiology, JACC. This article was in 2015 in June. I'll show you that in a minute. But here's the title, and it's intriguing given the topic we're talking about. Vascular calcification, arterial damage, and decline in renal function may be triggered by the inhibition of the vitamin K-dependent protein matrix gamma-carboxyglutamic acid, GLA-NGP, by vitamin K antagonists. Maybe we can simplify that just a minute. Basically, the story is this. We have known for a long time that people on K1 inhibitors, specifically warfarin, tend to get a lot of increase in calcification of their arteries. Now, what's that got to do with K2? I'll leave that for a little bit later, but it does. And I'll tell you this, it's some of that connection has to do with GLA, the matrix protein. But let's not get too far ahead of ourselves. Again, where was that article? Journal of the American College of Cardiology, June 16, 2015. Translate. Basically what they're saying is NGP, this protein, has a significant impact on deposition of calcium, is also impacted by an enzyme called matrix GLA protein. That matrix GLA protein is impacted by vitamin K. In fact, it's dependent on vitamin K. So guess what? In addition to blocking things like warfarin, when they block vitamin K1, they block the K1's ability to change this GLA protein. In other words, this calcification depends on a protein called MGP, matrix GLA protein. That protein, in turn, is activated by vitamin K. Vitamin K, in turn, if it's deactivated by warfarin, then takes you back to where you're starting to get a lot of calcification. That's the basic point. Warfarin inhibits the function of MGP, which in turn antagonizes or stops the inhibitory role of NGP in the process of vascular calcification, therefore resulting in arterial damage and decline in renal function. If that still sounds a little bit confusing, maybe this next couple of images will help. Here's the matrix GLA protein. It's non-carboxylated, so it's not active. There's a process called gamma carboxylation that activates this matrix GLA protein. However, vitamin K antagonists like warfarin stop that gamma carboxylation. If warfarin stops that gamma carboxylation, then the matrix GLA protein cannot be activated. If it's not activated, it can't participate in helping pull calcium out of the arteries. So that is that's the connection, and it has to do with basically inhibition of an activator. That's where you get a little bit confusing. To show this on the K, and if you're thinking about, well, wait a minute, this is all K1, Brewer. We're talking about K2. They're very different. I understand that. But as I said earlier, there is a connection in this metabolism, and it has to do with the carboxylation. So if you look at warfarin metabolism, it comes in and blocks vitamin K reductase and oxidation of vitamin K, and therefore it blocks the development of the MGP development, basically. Now, here's another way of looking at it, and it starts to get back to the vitamin K2, the menaquinones. The matrix GLA protein, remember that? And if you're thinking, Brewer, that's an ugly image. I understand that. No apologies. That matrix GLA protein, UC means uncarboxylated. So if you want to activate the matrix GLA protein, you need to carboxylate it. The matrix GLA protein decreases calcium and therefore inhibits vascular calcification. We're going to study in other videos. We're going to look at osteocalcin, which is a different enzyme. It does exactly the opposite of matrix GLA protein. When it is functioning, it increases calcification and actually promotes bone mineralization. So matrix GLA protein pulls it out of the vascular area, and osteocalcin puts it in the bone. Now, this has probably been a little bit much in terms of trying to get the connections. We'll do several other videos in this area. I just wanted to show the science is also pretty clear on these actual enzymes. This, for example, is the actual amino acid series involved with the protein. So that is the protein itself, GLA protein, matrix GLA protein in amino acid format. So again, maybe this was a little bit confusing. I hope not. It's just the first in a series that I'm going to be doing on K2. Actually, it's not the first. I'm doing another series on K2. If you've made it through all this stuttering and stammering and you're still there, I appreciate your interest. My name is Ford Brewer. I started off as an ER doc, became very frustrated with the fact that most things that bring people into the ER were preventable, like heart attack and stroke. I went to Johns Hopkins to get training and ended up running the program there in prevention. There I trained dozens of docs, and again, that was 3 decades ago. Since then, I've trained thousands of docs. And even more importantly,
supervised those docs, and even most importantly, helped thousands of patients prevent things like heart attack and stroke. Waiting for the disease and hoping for a cure for this kind of devastation doesn't work. Come to Louisville, November 8th and 9th. We have a boot camp type of environment for 2 days where you learn all the things that you didn't learn from your doc in terms of heart attack, stroke prevention, things like cardiovascular inflammation, how to detect it, how to measure it, things like insulin resistance, the number one cause of inflammation, how to detect it, how to measure it, how to stop it, how to manage it. You also get, you can get the labs there for that event if you'd like and get a complete evaluation. In addition, you get an arterial scan called a CIMT. To get the right one of those is fairly difficult. So I'm looking forward to seeing you there. Thanks. So with K2, there appears to be a role with calcium, a role with insulin resistance, and a role with inflammation. One of our recently released videos on K2 and artery calcification got a lot of attention. It wasn't all the good kind. I ended up saying, I hope this wasn't too confusing, because I went around a couple of times. Bottom line was, it was confusing, and I think it was too confusing. So I'm going to try to clear up a couple of things in this video. Now, in order to clear those up, though, I think we have to start getting into an issue, maybe a bigger issue of biology, and that is what we call pleiotropic roles. What are pleiotropic roles? We'll talk about them in just a minute. But the short version is it's multiple roles from the same thing. Now let's go back and understand pleiotropics just a little bit more. Pleiotropic, if you look it up on Google, producing or having multiple effects. One of the key places that we see this in medicine is in genetics. We have pleiotropic genes. For example, the Marfan's gene. It creates long fingers, a thin body, misshapen chest, mitral valve problems, joint problems, eye problems, a lot of things that may seem to be unrelated until you start going deeper. Now, we all see this. You don't have to be a physician or a geneticist or any of that. You all see this when you take simple medications, even including over-the-counter medications. Let's go back to something most of us have known, most of us have probably taken it, good old-fashioned Benadryl, an antihistamine. It's given for anti-nausea. It's given for sleep. It's taken for anti-allergy medicine, of course. That's the most common use. It's also taken for anti-itching. So, again, multiple uses for that antihistamine, which until you begin to understand things a little bit better, may seem unrelated. Well, with drugs, we often call these pleiotropic effects as, quote, side effects. Now, here's the other thing to think about. As I said, all these different effects may seem unrelated until you go a little bit deeper. For example, with Benadryl, what's sleep got to do with anti-allergy and what's all that got to do with itching? All of that basically has to do with a thing called histamine. And this is an antihistamine. When it blocks histamine, it starts having all of these different effects, pleomorphic effects. With that Marfan's gene, the Marfan's gene changes the way the body makes connective tissue. Well, places where connective tissue is a big deal in terms of the shape of the chest, how long fingers are, eyes, the aorta, which can kill Marfan patients at age 30, mitral valve, all of those things have to do with the Marfan gene impact on connective tissue. So we talked about pleiotropics, $5 word to basically mean multiple uses or multiple roles. Let's talk for a minute about the rest of this channel. This is not the first time we've mentioned pleiotropics. For example, we've talked about pleiotropics with statins multiple times. Remember, most of the rest of the medical community prescribes statins for impact on cholesterol. I don't, usually. When I do recommend use of statins, it has to do more with the pleiotropic mechanism, or what other people might consider the side effect, the impact of statins on cardiovascular inflammation. There's another place that I've mentioned a few times, but not that often unless you've gone into some of our cognitive decline, our Alzheimer's videos. And it has to do with insulin. Insulin has significant pleiotropic effects. We talk about insulin all the time on this channel, but it's mostly the impact of insulin in the rest of the body. If you inject insulin into the nose, it will go past the blood-brain barrier. And once insulin goes past the blood-brain barrier and gets into the brain, it has a whole different set of mechanisms. Most of them are revolving around the hippocampus and the biochemical mechanisms of memory formation. So again, biology can be a little bit complicated. Medicine can be complicated. But you know what? We need to understand some of these things if we're going to do the best job for preventing heart attack, stroke, and obviously cognitive decline. So back to heart attack and stroke and K2. So what are some of these different mechanisms for K2? Well, first of all, K2 carboxylates, a couple of enzymes that are very important in several processes here. One was that first enzyme that I mentioned in this maybe botched presentation on artery calcification, MGP, matrix GLA protein. The other enzyme that K2 carboxylates is osteocalcin. Now, we're starting to get a little bit technical here. I'm going to jump back up to about 30,000 feet and say, look, you see it in 2 or 3 places here. It activates those enzymes. Those enzymes we know have a lot to do with calcification of the bone and calcification of other tissue like plaque. Look at the bottom line here. They also impact plasma glucose and insulin sensitivity. On the way there, there's an impact on inflammation. And it impacts some markers that we've talked about multiple times, again, on this channel involving inflammation, AMPK, PPAR alpha. So, again, K2 has a few more effects and impacts and roles than I think that we just don't completely understand yet. So another way, again, of looking at it is this is vitamin K, and this involves both K1 and K2. It involves anti-inflammatory effect, regulation of adipokines, lipid-lowering effect, calcium effect, insulin sensitivity effect. Lots of impact there. Lots of different roles. And again, if you've made it this far, I appreciate it. Thanks. So you've been asking about it. When's the CIMT Access Tour starting? Anaheim, LA, September 28th. David Mikes will be there with a CIMT tech. It's about $250 for the whole afternoon, plus the CIMT, plus the reading on the CIMT. If you have further interest